So reflecting on what we've learned in this semester, I think ethics was the biggest thing. I've definitely taken like philosophy courses and things of that such, but actually taking a deep dive into like understanding the ethics. As a person, you have your own morals, you have your own ethics, and then when you go into your profession, you have to align yourself, or you should align yourself with similar, ethics and morals. And in healthcare, we do that. But getting to see the difference between like ethics and law and how they like kind of clash heads was really interesting to me, because it made me feel like there was still a big disconnect, at least in the healthcare field. There's probably a disconnect in other fields and things of that such, but definitely in the healthcare field. And so when we did the assignment that the athlete's family, wanted you to falsify medical documentation, I thought that was a great way to kind of take a small step into like understanding that and really getting to be like, okay, well, here are professional, ethics and morals, my own ethics and morals. These aren't really aligning, and this could get me in legal trouble. Ethically, this is not helpful to me. Some might argue that for the kid, it was, substantial for him to get a scholarship, and I understand that. But ethically, for my profession and for me personally, that was not going to be something I was going to do. And I think that was a really good assignment to kind of open up our eyes for people that hadn't had to deal with that yet. Decision-making approaches, have they evolved? 100%, because if you would have asked me to do like an ankle eval, like when I first got here, probably would have not been something that I would have agreed that it was correct. But the place I'm at right now, I'm at EMCC in Mississippi. They've given me a lot of freedom to assist and even make my own medical decisions when it comes to patient care. And it got me thinking more about how in healthcare we like to standardize things, because it does give some meaning of, okay, this is best practice. But at the same time, there's no way you could ever standardize everything. Every patient's different. Everything's going to have to be modified, essentially. But I think it's great that we do attempt to standardize things, because those do help us make guidelines with our clinical decision making, which is considered best practice. A good example of that would be our kid. We just had a football kid. He was in practice on earlier last week, and SC sprain, grade 1, super, we could be conservative with it. The athlete had been coming in twice a day to do treatments, to do work on it. We'd really gotten him to a point where like he should be perfectly fine. Then we played a game. He ended up with an AC joint sprain on that same side. So SC, now he's got an AC. This is, not been a great week for this kid. He did make really good progress. We wanted him to continue to play, but ethically and legally, this could have been worse, When it was just the SC sprain, we had, talked to our doctor. We had talked to, multiple people, and it seemed like it was going to be an okay decision. We did precautionary measures. We did the little pad and everything like that. We made sure his range of motion was great. We made sure his strength was great. Like, he seemed ready. Unfortunately, he wasn't. And now we see that, we couldn't prevent the injury that was going to happen necessarily. We weren't expecting an AC sprain to happen on that same side, but that whole decision, being in the tent and having to make that decision with the doctors right then and there that kid was done, and then later taking into the doctor in the office setting and being able to reevaluate and decide what was best. We decided that he will not be playing this game this week, but hopefully we will have him back for next week. But when we were in the tent, we had to, use prudence. We had to decide if sending him back out there was appropriate, which was not going to be appropriate. That would have not been best practice at all. Educating the athlete and telling him, this is going to cause more harm than good if we send you right back out. We should keep you out, and we're going to rest you. And, we want to ensure that our decision aligns with best practices, and we want to mitigate any further risk. He was not too happy to hear that, but he's gotten over it, and we're just going to take it day by day with him now. But I think that example kind of tied everything together because it made me think about all the ethical decisions and the legal ramifications that I needed to work with an athlete with this kind of injury.